diabetes essentially is where there's high blood sugar because either the body doesn't make insulin, which is type 1 diabetes, or doesn't make enough insulin or the insulin isn't working well, which is type 2 diabetes.
Type 1 diabetes usually develops in childhood, although adults can develop it. And it is where the beta cells in the pancreas stop making insulin. So they are 100% dependent upon insulin delivery in some, whether it's injections or insulin pump or what have you.
Type 2 diabetes is associated with obesity, and we still see that in children these days, and it's associated with a resistance to the action of insulin, not so much insulin deficiency.
For type 1 diabetes, unfortunately, we have no way of preventing it. Despite a ton of research, we have not found a way of preventing it. So for type 1 diabetes, it's really about early diagnosis and early treatment.
Oftentimes I'll tell the children that, they were in the wrong place at the wrong time with the wrong kind of genes. There was nothing that they could have done to prevent this. It's not that they ate too much sugar, it's not that they misbehaved or did something to their brother. There was no way to prevent this from happening at this point.
Type 1 diabetes, the onset is relatively rapid, and so you might not have a lot of warnings.
Classic in children who are presenting with type 1 diabetes is increased thirst, increased urination, unexplained weight loss. Sometimes they're excessively hungry, they can be irritable. And type 2 diabetics can present with those symptoms, or they can present with no symptoms at all, and it's just picked up on screening lab work.
So for type 1 diabetes, the only treatment is insulin. We can use other things in addition to insulin, but insulin is absolutely required.
Type 2 diabetes, we start with lifestyle modifications and then add oral hypoglycemic agents such as metformin. And if those don't manage your diabetes, then you would have to take insulin.
Reducing risk factors would be making sure that the child's height and their weight are appropriate for their age, that they're getting lots of exercise, eating a wide variety of fruits and vegetables, and not a lot of processed foods.
Americans eat huge portion sizes and high carb, high fat meals, and we love sodas and juices and sweetened beverages, and McDonald's supersizes your sweet tea and those kinds of things. Those are all risk factors. Even if you're not overweight, if that is the type of diet you're consuming, then you are at risk.
Then there's a number of different medications, both pills, both shots, or insulin. And we really can customize the therapy to what is best for each individual's risks, what their insurance can cover, or what they can afford to take, and what they're willing to take.
Be patient. Take the time to get the diabetes education that you need to understand how to take good care of yourself, what's going to work for you, what fits into your lifestyle and your schedule, and just trust your providers who have your best interests at heart to help you go down that journey.
I would love to have a generation, or from this generation moving forward, that they don't have to deal with the complications associated with diabetes. We have much better tools now than we did even 10 years ago. I've been here for 25 years, and it's amazing the difference in how we manage diabetes now versus what we used to do 25 years ago.